If it is less than, if it is less than
Hello.
10%, then it can be pardoned.
Hello.
Yes.
Hello.
Yes,
I would
please.
like to speak. I'm Dr. Alpa Mudi from Thane.
Yes.
I'm a surgeon.
Yes.
During cholecystectomy, if there is a portal vein injury, portal vein being a very big vein, the
Yes.
bleeding will be very much noticeable at the time of surgery itself. The fact that patient had the problem next day means after 24 hours. That means there was enough time for the portal vein to leak out and there was a collection, and patient would have definitely shown signs of hypotension, tachycardia, breathing difficulties,
No, no, madam,
distension of the abdomen.
my point is, madam, these things are not mentioned in the case report. I mean, legal case report. So that apart, what we are saying, how far percentage wise it is common to have portal vein injury during cholecystectomy?
It is not very common, sir, but
No,
it
no,
is a
you can,
detrimental side effect.
madam, I can defend this case if the percentage is known to me. It is not possible that you can defend the case when we say it's not common. We want the percentage wise. You
Now
have
that somebody will have to Google and
two,
find out.
for example, for example, in a healthy person, during general anesthesia, the incidence of somebody dying of a cardiac arrest suddenly is 1 in 1,49,000. So that sort of a statistics is required.
So
So
this is a iatrogenic complication that the portal vein has been cut. It's been cut and it may be a minor cut, but it has been cut by a surgeon while operating.
that is
So it's
possible.
a iatrogenic.
That is
Yeah,
possible. It is not negligence. It is an
it
accident.
is not negligence.
So
It is
point is,
accident.
we should be able to tell that this is so XYZ infrequent. Number one, and this can occur. That has to be documented in from the. I mean,
Yeah,
reference has to be given by from a textbook, and then it has to be properly defended.
right. So that is right.
Yeah.
And the most
So
important thing is how the patient was managed after the surgery.
afterward, yeah,
After the
whether this
surgery,
complication
how
was
the
thought over,
patient, how the
whether
patient
this,
was
So that is
monitored.
what I'm saying, that there has to be tachycardia,
well,
hypotension,
there must have been, madam, but
abdominal
these cases are
distension,
not discussed in
the
that
pain.
perspective. Those medical
Right,
details are not available with us. So we don't know.
right,
The patient must have been complaining of abdominal pain, tachycardia, falling blood pressure, and so on and so forth. We don't know about that.
right.
Okay, we go to the
Sir,
next.
But
sir,
as far as the incidence of this complication is concerned, I don't know exactly in percentage wise, but I think we have had a very long experience of almost 40 years in the operation theatre, giving anesthesia to so many cholecystectomies, and I haven't seen portal vein getting damaged in cholecystectomy.
Okay, so it is extremely uncommon. So less
Yes.
than 10%, we should have been able to defend this case. Why I'm saying 10%? Because this is the figure which is mentioned in Samira Kohli's case. So today, I would say this is a judgment of 2008, I suppose. So today, I would say less than 5%. If it is less than 2%, then that particular complication need not be forecasted and told in the consent form. So make it sure that don't go by 10%, you bring it down to 5%, 2% like that, because the days have changed. Today we are in 2024. Anyway, next case, it's a
Dr. Arun Mehra, please go ahead with your question, Dr. Arun Mehra.
well, I was going to say the same thing which Kelkar madam has said. I have 30 years of experience and I do not recall one single instance of portal vein damage as an anesthesiologist. I mean, exactly same thing as madam has said.
So can we take it as gross negligence? If it doesn't occur,
It could be an accident, as one of our friends has
No,
pointed
no,
out.
we should say take it as an accident.
Yeah.
Because accidentally anything can
Sir,
happen.
And yes, this is another valid point that
sir,
if there
Google.
is that level of bleeding, we will have immediate hypotension, tachycardia, maybe saturation will start falling, and all kinds of things will happen. So, as one of our surgeon friends has pointed out, that if it was found the next day, it was obviously some small, minor kind of cut, and for which nobody in the OT really can be blamed for not having perceived at that time if the patient was shifted out in a satisfactory condition.
Now, how soon?
anyway, we don't know about those details from the case being reported in the legal forum. So we also know that it could be a slow leak, it could be a progressively falling, deteriorating condition. They might have been attended also. At the last minute, they might have thought of shifting the patient. We don't know all those details. So anyway, if,
Sir,
So
Google
they-
says
they
it is
want to-
around
if it does not
2.2%.
occur at all, then probably accident is one aspect, but it could be a gross negligence which ought not to occur otherwise. So that way also it can be looked upon.
If the patient is operated late, there will be
Dr.
infection.
Behere, please go ahead with your question, Dr. Behere.
Dr. Behere, you have to unmute yourself and then you can speak.
In the infection is
Yes, yes,
long-standing
please go ahead. Yeah.
Hello,
distortion of the
am I audible?
Yes, yes.
The portal vein injury complication is far less, is more than 0.5%, less than 0.5%. It's less than 0.5%, 0.5%.
So only thing it boils down
So,
legally
so
is
it's a question, probably it was, might be a slip of ligature of some trajectory of the portal vein,
okay.
which
So-
occurred afterwards, but that has to be mentioned in postmortem.
Yeah.
So that's why what becomes important is how the patient was monitored post-operative
Absolutely right.
and what
Correct.
actions were taken when when the patient was deteriorating.
Correct.
If these two are proper, then there is no negligence.
That's right.
We will go to next case. I will stop recording and start it again.
Yeah. Yeah. So we go to the next case.